Now we discuss the case of a 36-year-old male who presented with cervical radiculopathy in the last few months. So an MRI has been done and they have detected a lesion at the level of C6 and C7. It was differential diagnosis was given as schwannoma versus dural based meds, and he was planned for surgery. But they wanted to go for a PET scan and then decide on further management. So he's being sent to our center for PET CT. This is a whole body MIP image of this patient which shows physiological tracer uptake in the brain, heart, liver and spleen, kidneys, urinary bladder, and these heterogeneously seen tracer uptake is the bowel loops. It might be non-specific or seen in diabetics also. Apart from these, we see some tracer uptake in the neck region over here and apex of right lung as well as left shoulder. So moving on to the transaxials, we see an ill-defined soft tissue in the prevertebral region at the level of C6 vertebra, extending to the C7 with an intraspinal component, a subtle enhancement over here, with permeative bone lesions in adjacent C6 and C7. The tracer uptake which we saw in the left shoulder joint could be early degenerative changes. It is in the soft tissues around the left shoulder. Whereas the other focus at the apex of lung could be fibrotic changes at the right lung apex. Biopsy and histopathology from the metabolically active prevertebral soft tissue component will solve the puzzle in this case. Most likely it looks neoplastic. A proper biopsy and IHC correlation is needed to rule out possibilities like lymphoma in this case. This case highlights the importance of detecting a lesion in this patient with cervical radiculopathy, and a proper biopsy and IHC will give the correct diagnosis and further management.